So you might be considering a career as a nurse in general practice and might be wondering, what is the salary of a practice nurse? The truth is, every practice will have different remuneration arrangements for their nurses. This is because what works well in one clinic may not apply in another clinic, even if it's down the road. In Australia, we have the Nurses Award, which outlines the absolute minimum salary rates, penalties, and conditions which an employer must provide for any employed nurse. Some clinics will remunerate their nurses as per the Nurses Award. However, because these rates can be considered quite low, most practices will usually pay either slightly or considerably above the award level. This is sort of used as a way to attract and obviously retain skilled nurses. So with that out of the way, what do practice nurses actually get paid across Australia? As a point of reference, the Australian average for a practice nurse who's a registered nurse Division 1 is around $31 to $34 an hour for part-time or full-time work. This is slightly lower for enrolled or Division 2 nurses. The Australian Primary Healthcare Nurses Association, APNA, puts together a salary and conditions survey every year. You can visit their website to check out the most recent results or to view how things have changed over the previous few years. It's important to remember that you can always negotiate your salary and conditions with the practice. Some practices will be quite committed to supporting their nurses and might even be willing to provide you with either leave to attend CPD events or might even help pay for CPD courses. Also remember to check with your practice if they currently provide any other employment incentives aside from salary. Here's an example of a nurse incentive beyond simply a salary. Some clinics may give nurses a bonus payment for every health assessment or chronic disease management plan they help create. Not all clinics offer this, but those who do may incentivize nurses with an extra bonus which might vary between $15 to up to $70 per assessment or per plan that they perform. In these instances, you may find that the salary is usually a bit lower, but the incentives help to bring up the overall take-home pay. There's also an expectation that nurses working in this capacity will be very self-driven. They'll be motivated and will work quite autonomously to ensure a smooth process for both the patients and the practice. But what if you don't have a lot of experience in the general practice field? Well, in this case, it might be worth taking a lower paid practice nursing position temporarily. This way you can get some field experience under your belt and later start looking for either a higher paying position at another practice or renegotiate your salary with your existing clinic now that you've proven yourself to be a valuable member of the team. Make sure to check out our guide on how to look for a job as a nurse in general practice for tips on how to go about hunting for your dream position as a practice nurse.